Today, I'm going to tell you how your legs and feet can warn you about your health. I'm a medical doctor, and I trained in internal medicine, which means I take care of men and women, young and old, and healthy and sick. And I'm also a scientist who studies blood vessels and what they do actually lead to those signs in your legs and feet that tell you if you got a heart problem. So I'm an expert on circulation, and what I'm going to tell you today will help you pay attention to what's going on in your legs when it comes to your circulation. Now, your blood vessels bring oxygen and nutrients and all the oxygen that you breathe, the nutrients that you eat, right, to the cells, muscles, tendon, and bone in your legs and in your feet. When those blood vessels are working well, you're actually going to be able to walk around and run and do all the things that you normally do in life without a problem when those blood vessels have a problem. One of the common problems is that they get blocked up with AOSC, Lodic plaque, they narrow down. Now think about it, it's like a drinking straw that you cut in half. What's going to happen? You're not going to get as much fluid in it, just like if you had a half the size of drinking straw, same amount of sucking up the liquid, it's going to be a lot harder and you're going to get a lot less. Now, that's frustrating when you're actually drinking out of a small, thin straw, but it's actually terrible when it actually happens in the legs. When your legs don't get enough blood flow because your blood vessels are narrowed, then you actually have a crisis in your legs, right? Because your muscles, when they're contracting, need oxygen. And they also need energy, they need glucose, they also need all the other things that are actually happening that your blood is carrying. So what happens when there's a compromise? Well, a sign that something's going on with your legs and feet is when you got cramping. Now, we've all had cramping before, but I'm talking about the cramping where you just walk like 100 yards and all of a sudden you can't walk anymore, like you've got this terrible cramp, and it can get worse and worse where you then walk even 100 feet. Or if you were in a shopping center from, one part of the store to the next, you can't actually continue because you get terrible muscle cramping. That's actually not normal. That's a warning sign that you're having blood flow problems, right, in your legs without enough blood flow. Your muscles cramp up, all right, and you got to stop. So cramping is one of those warning signs. Telltale warning signs that there is something actually going on because your muscles are carrying around your frame. They do a lot of work, and then when you're actually walking around, they consume a lot of energy. And if they're not getting that energy, they're not getting that oxygen, they're going to seize up, and you're going to actually have a cramp. Now, this is the condition that's called peripheral arterial disease, peripheral, because it's not central in your body. All right, it's certainly in your periphery. Your legs are considered to periphery, your legs and feet for sure. Peripheral arterial. So this means that the arteries are getting narrowed, right? And disease, obviously PA is what we call it, peroral arterial disease. If you were in England, they call it PAAOD, peroral arterial occlusive disease. Occlusive means it's actually getting very, very narrow. And this is actually a problem because that I know about, because what you really want to do is to stimulate new blood flow in order to grow around the blockage to restore blood flow. Right now, what happens if you have this type of cramping? A surgeon, a vascular surgeon, will do all the studies to define exactly where the blockages are. And they can take a catheter through your groin and stick a balloon all the way down into where the blockage is and blow the balloon up, press the plaque out, or just actually rotor out the blockage and maybe put a stent in. Okay, this is like a wire basket that pops open and pops that blood vessel open where it was narrowed, and now you've got blood flow again, so you can actually solve this problem of peripheral arterial disease with a stent or angioplastic, which is actually where you blow up the balloon to be able to open up the blood vessels. Now listen, this is not a local problem. People with peripheral arterial disease have a systemic problem, so it's narrowing of the blood vessels everywhere. These are the people that have narrow blood vessels in their organs, in their brain. So they can also have basically narrowing of the brain blood vessels. And that can lead to cognitive issues, memory problems, and in fact, ultimately vascular dementia. Vascular dementia is much more common in Alzheimer's disease. It's actually something that we see as blood vessels get hardened, okay? So now you learn about one warning sign, that is actually cramping in your leg. Now a warning sign, number 2, that you should be aware of is when you actually have a wound on your feet that doesn't heal. Now look, most people, if you cut your feet on something like step on a piece of glass, step on a nail, hopefully you had your tetanus shot, but let's say you cut yourself. what's going to happen first? You're going to react in pain. Ouch, pull your feet back, and then you're going to lift your foot up, okay? You're going to see if it's bleeding, and if it's bleeding, you're going to rinse it off. You're going to wash off all the bacteria that might be on there, could put a bandage on it, right? And basically, as long as you keep that clean and it's not too deep, and you've removed all the foreign material that's there, which is why you want to really wash it off, well, that wound will heal up. I mean, it starts to heal as soon as it forms, but by a week to 10 days, your wound will actually do pretty well. The foot, the bottom of the foot especially, is a very dirty part of our body because it's in contact with the ground or the inside of your shoe. You know, we wear shoes so we don't actually get our feet dirty, but you know how dirty the inside of a shoe is. Nasty. Inside of an old tennis shoe or, you know, an old pair of work shoes that you're actually wearing every single day, not good. So if you're going to actually cut your foot normally, you know, wash it off, put a Band-Aid on. You might want to put a sock on before you slip it into a shoe. And a lot of people say, well, just walk around flip-flops. Well, be careful because then the bottom of your foot's exposed to everything. So put a bandage on, check it, change that Band-Aid. After a day or so, take it when you take a shower, take a little bit of soap and clean off the cut area as well. Believe me, if it's normal, a cut on your foot will actually heal up. But that's not the warning sign. The warning sign is actually when the wound that's on the bottom of your foot doesn't heal. In other words, the wound, you get a cut. The cut may not even be painful, but it's there and it stays there more than a few days, more than a week. It's there 2 weeks later, what it's not healing. Yet it's 3 days later, still not healing. A lot of people don't even know that they actually have a foot wound. Particularly, they've got diabetes because the nerves in some conditions like diabetes are dying back. If you don't have enough nerves in your foot, you're not going to feel when you actually cut your foot right now, those nerves are dying back because the blood vessels that support the nerves are damaged. This is one of the issues with diabetes. You've got a diabetic neuropathy, which is actually a problem with the nerves dying back. So diabetics have difficulty feeling the bottom, the soles of their feet, very easy to step on a piece of glass, all right, and be cut. And you don't even feel it all right now. One of the reasons that the nerves are dying back is that the blood vessels feeding the nerves are insufficient or they're blocked up, all right? So every nerve has its own blood supply feeding. It makes a lot of sense, right? You got a telephone line that's going from pole to pole along the highway. You're going to have a support line going along with it. And those blood vessels are the support lines bringing oxygen and nutrients to the nerve along its entire journey on the bottom of your foot. Now, I told you that in diabetes, there's blood vessel problem S, and those blood vessels feeding the nerves are not normal. They're dying back. And now without oxygen and nutrients, the nerves die back. And now you have an understanding of what diabetic neuropathy actually is. Problems of the nerves start with problems of blood vessels. And that's an area that I study. So that's why I'm going to give you this level of detail now. When you cut yourself, you need blood vessels to grow back. That's a process called angiogenesis. Blood vessels, genesis is how they grow. And this is actually very, very important over your entire life, that your body is able to use this process of androgenesis, one of the health defense systems, to make sure that all the tissues in your body have the right amount of blood at all times, all right? And you got right amount of blood flow. So in diabetes, you wind up having damaged blood vessels. It's the lining of the blood vessels, the endothelium is what we call it, is damaged, all right? And when that's damaged, the blood vessels actually more easily clog up, okay, and also clot. And when you have those ever narrowing blood vessels that happens in diabetes, when those are the blood vessels that follow the nerves and support the nerves, when those blood vessels go, guess what? The nerves go. So diabetic neuropathy diseases of the nerves are partly caused by diabetic vasculopathy, meaning that diabetes causes a problem in the health of the blood vessels, bad blood vessels to nerves, bad nerves, right? So this is what actually happens in the feet of people with diabetes. So they don't even feel it when they step on a nail, when they step on a tin can, when they step on a piece of glass. And that cut that occurs, actually, you can be dragging it around for a long time if you're not checking the bottom of your feet. If you don't feel a pain, remember I told you normally you step on something, you cut yourself, boom, you pull your leg back and you go check your foot. That's the natural instinct. But if you don't feel it now, you're just going to, after the cut, you're going to just slide your foot back into your barefoot back into the shoe and tool around. And you might not even know that you actually had a cut. And in fact, some people with diabetes winding up having these foot wounds don't even know that there's an injury until days later, maybe weeks later. They start smelling something really foul coming from their body, and it turns out to be coming from their foot because now they've got rotten tissue. That wound is not healed. And that's the warning sign, a chronic wound that doesn't heal. This is actually something that's pretty common, unfortunately, in diabetes. And also, it can also happen with peripheral arterial disease. But it's kind of a silent epidemic. People don't like to talk about holes on the B and the feet that aren't healing. And doctors actually don't know. Most doctors don't know how to actually handle a diabetic foot ulcer. Now, I happen to be one of the people who've led to charge both research, treatment, policy wise to figure out how to actually heal these chronic wounds, because you know what happens if you don't heal that chronic wound. Unfortunately, that wound will get deeper and deeper because it's not healing. The bacteria will kind of get in there and it'll start losing pus, all right? And then the tissue will start to die in that area. And eventually you could actually get an abscess. The bacteria can get into your bloodstream. You could get septic. And by the time many patients, actually, you want them going to their doctor, and their doctor goes, hey, I don't know what to do with that. Finally, the patient gets referred to a wound clinic, all right? There are, several hundred wound clinics around the country, not enough of them by any means compared to the number of people. Diabetes and those special wound clinics have trained staff and experts, clinical experts that know how to actually apply advanced technologies to be able to start healing that wound. If you don't go to the doctor, all right, you're going to be walking around with basically a rotting piece of your foot that's going to get worse and worse. And when that rot continues to go bad, you can get gang GRE. So the treatment for diabetic foot ulcers, when it's detected early on, we'll clean out the wound. We maybe even cut out the non-healing wound to kind of get a fresh margin. And then there's all kinds of different tricks of the trade that can be applied that actually work really well. Everything from putting a living skin equivalent, it's kind of like a living bandage on it to help heal. There's a growth factor. It's called Rannick by Capman. It comes like in a small tube, like a travel tube of toothpaste. You squeeze some on there. It's a protein that stimulates AT's angiogenesis, so it stimulates healing. That's already way too slow in the diabetic foot, somebody with diabetes. So just go ahead and stimulate it. And in fact, this growth factor gel, the thing that comes in a toothpaste called Bapin, was FDA approved because clinical trials showed that it actually sped up the rate of wound healing. What does it do? It stimulates angiogenesis, more blood vessels growing. Guess what? Not only is it healing the wound, repairing the wound, but the other thing that it's actually doing is that it's also helping to restore the nerve function as well, and nerves will grow back. Nerves will grow back if you allow them to grow by eating the right foods, by not killing the nerves. Some more nerves grow back about 1 millimeter a day. That's about a millimeter right there. Okay, a tiny bit. Then the next day, then the next day, and then next day, you can actually grow nerves back pretty quickly, all things considered. All right, so the warning sign we're talking about here are chronic non-healing wounds that might be on your foot. You should always check your feet if you've got diabetes before you go to bed. You should, cross your legs, look at the bottom of your foot on the right, take a look at the bottom of your foot on the left, check around your ankles, make sure there's no wounds. And if you're actually taking a shower, that's another example, another opportunity to be able to take a look at your skin on your foot, and also keep it nice and clean. All right, soap up your foot. That's actually a really important little tack, I would actually say, in order to be able to avoid the problem. But if you actually have a non-healing wound time to see a doctor, all right, you're probably going to need to be seeing a wound specialist, somebody who works in the wound clinic, but don't be afraid to advocate for yourself and ask your doctor to refer you to a wound care center. All right, they're around and they have all the technology, all the tools, hyperbaric, living skin equivalents, growth factors, all kinds of different things. And most importantly, the experience of actually getting a wound to actually heal back up. If you don't, I'm just telling you, these wounds will get worse and worse. They'll get infected. Your immune system in diabetes is also lower. So now you've got poor blood vessels, poor nerves, and now you got an infection and your immune system is also down. This is why Diabetic foot ulcers are a common reason that doctors wind up amputating the feet and the legs of patients who have these chronic wounds. So you don't want to be there. I trust me on this one. All right. So that's a second tell warning sign, which would be actually a wound on your foot that doesn't heal. All right. Now, telltale sign number 3, major swelling in your feet and ankles and into your calves, right? And you've probably seen this, recognized this. I mean, you've seen somebody, maybe they're on a bus or in a subway, they might even be on a plane, maybe on a beach, but somebody who's got, really, really swollen calves and ankles and foot. And the foot is sort of kind of like pillow shaped, really, really swollen, and it's actually filled with fluid. Now, swelling in the feet can actually happen for a lot of different reasons, all right? Some of the reasons that are harmless are, for example, if you're on a long plane flight. So you're flying across the country, flying across the ocean to Asia or Europe. You're sitting there for a long time. And even though an airplane has a pressurized cabin, they artificially put air pressure in the cabin. It's a lot less than when you're actually noted an airplane standing on the ground. All right, so with lower cabin pressure compared to what is on planet Earth when you've got your feet on the ground less, pressure means that the water inside your body can seep out under the skin, not through the skin, under the skin, from your blood vessels, out into the tissue, out towards the skin, and the leg, the calf ankle swells up, the foot swells up, all right? That's called pedal edema, PDL, pedal edema, and the fluids pooling into them, connective tissue in your under your skin. Now we test for that to see what if it's really fluid that is just oozed out by pushing a finger into the swollen foot or ankle or calf. When you push in, it's kind of like the Pillsbury Doughboy. Or pushing into a ball of pizza dough, you're going to get a fingerprint in there, or a thumbprint if you use your thumb right in there. Okay, and you'll see the indentation will stay there for a little while before the fluid comes right back out and actually removes and fills back out your fingerprint or thumbprint. That's pedal edema. And it can actually happen a little bit when you're flying on a very long haul flight, not enough air pressure. And so for some people, not everybody, for some people, the fluid actually comes out, and that's a relatively harmless situation. If you're taking a flight, once you land, you might have a little more problem than you'd expect by putting on your shoes. But then once you're walking around, okay, you get your luggage from the overhead, you walk off the plane, now you're walking through the terminal to the baggage claim or wherever you're going. All right, that physical activity back on terra firma on regular Earth, okay, with higher pressure is going to push that fluid back into your blood vessels, and then your veins will actually take it all back into your heart. And now it's out of your ankles and calves and feet back into your body, all right? So that's the harmless kind of swelling. But if you have it, you want to pay attention to it because, it's something that it's just one of those telltale signs that something is going on in under normal conditions. It's just less air pressure around you, okay? But it's hard, and that's particularly harmless. However, there are situations where edema can signify something really, really severe, all right? Lower extremity edema is what we call it. All right, now this is now one of the things I told you about is these really fat, swollen feet and ankles. And now when you actually put your finger on it, pitting edema, it's like I said, like poking a piece of pizza dough. You'll see the hole where your finger was, and it will take a long time before it actually fills back out again. All right? And this can actually go all the way up your shins, all the way up to the calves as well. All right, you get that dimpling if you actually put your finger on it all right now. That's the kind of fluid that has actually come out. And the fluid is not going back in the blood vessels to the heart. So this pitting edema is actually not a normal situation. And it can actually happen when you have congestive heart failure. So pitting edema, all right, big fat calves, ankles, and feet, all right, might be a sign that you have congestive heart failure. And that's why when you have edema, that doesn't go away time to talk to your doctor and get some attention to it. Even though we're talking about the foot, that might actually be the tip-off, that there's something going on with the heart. And a doctor can actually use an ultrasound and do a stress test and do all kinds of different types of testing in order for you to be able to actually check the vitality of your heart. All right, now, how does heart failure cause leg swelling? Well, our circulation is a closed system. So the heart right here is pumping, 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 jetting blood out through the artery. The big artery is called the aorta, right over the top, kind of like a fountain, like the fountains of Bellagio squeeze pump. Blood goes out the heart, all right, and the arteries take it to all the rest of the body. But what happens is that it has to return, the blood has to be returned on the other side through the venous or vein system. All right. Now, if the heart is not doing vigorous pumps, but it's getting blood out there and the blood is coming back to the heart, but the heart can't accept it fast enough. So you're pumping out and now it's like wiggly jiggly. It's not ready to accept more. Yet more fluid is coming back. Yep. Well, okay. We'll get it again. Let's do another pump. And it becomes kind of like a feeble, half-hearted pump. What happens to the water, the blood that was supposed to come back? The blood backs up, okay? It's like a toilet that's not flushing completely. The fluid backs up. And then when it backs up from your heart, it backs up all the way in the other side of your veins, right? You're not moving fluid through your heart. That's supposed to fluid comes into the heart. Fluid is pumped out of the heart. That's how it's supposed to work. But if the fluid isn't going out of the heart as quickly, it backs up and